So let's start with the first one, and I want the interactive session and the participation from all the participants from this session. A 69-year-old male patient who had been hospitalized twice because of bacterial pneumonia. 3 weeks prior to admission, the patient had suffered fever, dry, irritating coughing, 0.5 to 1 centimeter nodular lesion on the dorsum of the tongue. As a result, the patient had been unable to eat. 2 acid-fast bacilli were positive. Tuberculosis testing, X-rays, and history confirmed the diagnosis. Tuberculosis treatment was begun. After 2 months, the nodules disappeared. The physician has written detail about the patient. Now, what is the study design that we have been referring to? A very simple
case report.
Very nice, excellent. So in a case report, we know that a detailed report by a physician of an unusual disease in a single person. However, this unusual again depends upon the context about the country. I remember when I was in Fleming Institute in London, they asked me, have you ever seen a disease called tuberculosis? I said, yes, more than 600 cases. And they were surprised. They said, no, it is a very unusual disease. And all were HIV positive. I said, no, we have tuberculosis in all our departments, in chest department, in our gastroenterology, in medicine department, every third or fourth bed is being occupied by a person of tuberculosis, either having Carey spine or having tuberculosis peritonitis, or in cardiology, tuberculosis pericarditis, or in chest ward, having miliary tuberculosis, etc., and they were surprised. So the case report, the unusual disease also depends upon the context, about the geographical distribution, about the factors, and we have to report the symptom, history, examination, management, and outcome. Having said that, now the next scenario, it is a little difficult than the first one. In 1980 to 81, 4 previously healthy young men were diagnosed with pneumocystis carinii pneumonia, an unusual opportunistic infection that had only been seen in immune-compromised people with hereditary disorder or in people with immune compromise due to chemotherapy. The medical histories didn't suggest any pre-existing immunodeficiency, but all 4 men had decreased immune responses and low T-cell counts. The unusual infection suggested the possibility of previously unknown disease. It was noted that all 4 men were homosexuals, and findings were published in the New England Journal of Medicine. Anybody?
Case series?
Yes, very nice. Excellent. We have the case series when several unusual cases, all with similar conditions, are described in a published report. And here, the geographical boundaries, they don't matter. Sometimes one case is being reported from one area, while the other case is being reported from the other areas. And you have seen in COVID-19, the first case was reported from China. Later on, more cases were reported from China as well as from USA. So the cases, they were being reported from different geographical areas, and they are having a case series. There is no control group. It is usually small number of the cases, but it can be very large group. So the case series can have a very large number of the cases, just like in COVID-19, you have seen there are millions of people who have COVID positive test on PCR, and they are reported as case series. Our next scenario, a researcher wants to determine the prevalence of obesity in a community and the associated factors. For this purpose, he went to the community, measured their BMI, basal metabolic index, body mass index, and asked about eating habits and physical activity. What is the most appropriate study design for this body mass index? Right. Anyone?
Cross-sectional study.
Very nice, excellent. So we have come up to this ladder of descriptive studies. Now this is the descriptive cross-sectional study. A cross-sectional study is a survey of a defined population at a single point in time. They are also called prevalence studies. It is just like a snapshot of or a picture of a community or a defined population. The most important part is we have to define the population and we have to choose a time. In that time, both exposure and the outcome, both are present at the same point in time. So there are few people who are exposed to the disease, few people who are not exposed to the disease factor, and some who have developed the disease, and some are in the process of developing the disease. So it is a cross-sectional study. Next, our researcher wants to compare height and weight of school-going girls and boys. He gathered data from the schools and found that the height of boys and girls were not statistically different. What is the most appropriate study design?
Cohort.
Comparative cross-sectional study. In cohort study, it can't be a cohort. The reason is that we are comparing height and weight of school-going girls and boys. We are not going in a forward direction from the exposure to the outcome, or from the risk factor to the disease, or from the protective factor to the outcome. So he gathered data from the school, and he is having different factors that are present, and he is just comparing them. So this is the part of analytical study. It is still a cross-sectional study because boys and girls, their heights, they are being compared at the same time. So the time is very important. So the group 1 is compared with group 2, and sometimes we have different groups like group 1, group 2, and group 3. So it is called comparative cross-sectional study. In a study done in Pakistan, an association was found between the sale of tobacco and increase in deaths due to asthma. This is an example of
causation.
Ecological study. We have the group data that there is a sale of tobacco and there is some association with the outcome, that is asthma. So it is some factor that is present and it is associated with the outcome. Next is an investigator takes a sample of healthy individuals, record their ongoing solar exposure, and relate that to the subsequent occurrence of the skin cancer in the same group. What is the most appropriate study design? Again, there is an exposure and it is being related to certain outcome. Exposure is there and then there is an outcome. So what would be the most appropriate study design?
Prospective cohort.
Very good. It is a cohort study because we are having forward direction. There is an exposure. We are going to follow them until they have the outcome. So it is a prospective cohort study. Very well done. How the cohort study, especially the prospective cohort study, that is being done. First, a cohort is selected. Cohort means they have the group that have the same type of features. There can be a cohort of you people who are attending this class. It can be a cohort of certain age group. It can be cohort based on having certain characteristics. Those cohorts are further divided in those who are exposed and those who are unexposed. Sometimes people will think that in cohort study there is a no control group. This is false notion. So make it very clear that in cohort study, yes, we have control group. And that control group is unexposed people. In exposed, there are few people who develop the outcome or the disease, other who have not developed the outcome or disease. Similarly, in controls, some develop the disease and other have not. Now, this would help us to find out that how much exposure is linked with certain outcome. Next, a researcher wants to begin study on association between smoking and lung cancer. He collected smoking habits from a college roster of 1999. Using this data in 2020, the researcher determined who has developed the lung cancer or not. So what is the type of this study?
Retrospective cohort.
Retrospective
Okay,
cohort.
excellent, excellent. Vasul Saab and excellent, Dr. Satya. Yes, it is retrospective cohort study that we have the exposure from the past, but still the direction is forward. The important point to note is the direction is forward. We have not gone from the outcome to the exposure. We have gone in forward direction. So the outcome has been reached and it is done with the cohort. Similarly, in retrospective cohort studies, records are selected of the exposed and unexposed, and then they are compared for outcome, with the outcome in exposed group, without outcome in the exposed group, with outcome in unexposed group, and without outcome in unexposed group. Next important thing is a researcher wants to estimate risk of bronchial cancer with smoking. 200 bronchial cancer patients and 400 pancreatic cancer patients were enrolled to assess risk of smoking and bronchial cancer. Results show that 80% of bronchial cancer patients are smokers and 52% pancreatic cancer patients are smokers. Which study design is used? This is a case control study. Now, the direction is from outcome to exposure. So the most important point that has to be noted here is in case control study, the direction is backward. It is from the outcome to the exposure. While in retrospective cohort study, the direction is still from the exposure to outcome. So when there is outcome, when the cancer is there, when the patients are there, when the cases are there, and you want to know what are the risk factors and you want to find the association, you are going in backward direction from the outcome to exposure. Here we have the case control study, right? So here you can see the backward direction. There are the cases with disease and there are controls with disease. And one thing is very clear that in backward direction, you have to go back into the time to find out that those who develop the disease, either they are exposed to the risk factor or they are not exposed. Similarly, control group, how many have exposed to the risk factor and how many of them have never been exposed to the risk factor and still they are there. So after getting all this data, then we have our case control study. I would not go into the analysis part, that how the odds ratio is being calculated, how the hazard ratio is being done, how the relative risk is being calculated. Today, I would focus only on study design. And all these study designs, they have been taken from very famous studies, right? So another very famous study, a researcher wants to study undernutrition in school-going children in a community. For this purpose, a longitudinal study is planned with 2,194 school-going children for 10 years. 5 children developed malnutrition at end of the first year. Individually matched controls were selected from the group of school-going children, which is the most appropriate study design. This is
case control study.
Ma'am, nested case control study.
Very good, nested case control study. This is the correct answer, Dr. Masood, that you have given. This is the nested case control study. We have both our cohort in it that is defined, who has developed the disease and who have not developed.
Dr. Saira, ये Professor Zaidi साहब ने कहा था.
Okay, thank you so much, Dr. Mulasim. Thank you very much, Dr. Zaidi, for very correctly identifying it. And we have the cases and we also have the control. Those who have not developed disease, they have the control. And in this, we have the nested case control study. So in case control studies, there is a defined cohort who developed the disease and who have not developed the disease. Then in 1 year, there is a case 1. In 2 years, there was a case 2. In 3 and 4 cases were in 3 years. And then so we have more cases in coming years. So this is a nested study. A researcher wants to test new anti-malarial drug. For this purpose, he selects confirmed malaria cases from hospitals. Computer-generated numbers are used. New drug is given to the patients while others are given standardized treatment after. Follow-up is done after 1 week. This is an example of
Experimental study.
Randomized control trial.
Please raise your hand because I would mix all those voices. Yes. Those who are giving the answer, please raise your hand. Okay. This is the example of
Randomized control study.
randomized clinical control trial, right? So we have a group, we have intervention, and we have the outcome. So the randomized control trial, we have the sample population, we have the group 1, and we have the new treatment and then the outcome. Similarly, we have the group 2, we have standard treatment or placebo, and we have the outcome. Next, a researcher wants to assess use of antibiotics, amoxicillin and cephalosporin for treating childhood pneumonia. For this purpose, he randomly allocated participants in group A, amoxicillin, and group B, cephalosporin for 3 days. Then after 2 days, he gives group A cephalosporin and group B amoxicillin for 3 days. Then outcome is measured. This is an example of
Crossover randomized.
very good, very good. Yes, this is crossover study design. That we have subjects enrolled, then we have randomization, and randomization can be done from computer-generated number, from lottery method, and there are certain methods for randomization. It can be simple random or it can be systematic random, and then we divided them into groups. Group A have X intervention and B have Y intervention. After the washout time, the most important point here is after the washout time, the group B is given group A treatment and group A is given group B treatment. And outcome evaluation is being done at following points. First, when the randomization is done and no intervention has been given. Then the first time intervention is given to group A and group B. Then we have to wait for the washout period. And then we have to cross over, and then we have again the outcome evaluation. So this is perfectly set. This is crossover design. Next, a researcher summarized the symptoms, signs, lab diagnosis, treatment, and prognosis of patients through literature search of articles of COVID-19. This is an example of
Review article.
Of
Review
narrative
article.
review, right, or literature review. As we know that every researcher has to stand on the shoulders of a giant, and that giant is literature review. So after a comprehensive, critical, and objective analysis of the current knowledge on a topic, journal synthesis of what has been done helps to identify gaps and areas where more work is required, and then comes the narrative review conclusions. Next, important study design. A researcher wants to determine the benefit of use of ivermectin in COVID-19 patients. We all know how the ivermectin has been used in COVID-19. Here in Pakistan, we also have other drugs like azithromycin and many other drugs. So he searched the databases and selected studies which meet the inclusion criteria. Information is gathered and combined to generate evidence. This is an example of
Meta-analysis.
there is a research question, there is a literature search, there is a screen studies, extract data, combine and generate evidence. Before meta-analysis, there is one other thing which has all these 5 components.
Systematic review.
Yes, good. That is systematic review. A review of clearly formulated question that uses systematic and reproducible method to identify, select, and critically appraise all relevant research and to collect and analyze data from the studies that are included in the review. It has rigorous scientific process and PRISMA guidelines are usually used. Next, a researcher wants to assess odds of smokers among cancer patients after selecting studies through literature search, which meet the inclusion criteria. Combined odds ratio is calculated. And this combined odds ratio gives us the more insight into this research. This is an example of, here we have studies that are selected, then outcomes are generated, and again the analysis was done by pooling all those numbers. This is the type of
Meta-analysis.
very good, Dr. Rehana, meta-analysis. Statistical analysis that combines the result of multiple scientific studies. Meta-analysis can be performed when there are multiple scientific studies addressing the same question, with each individual study reporting measurements that are expected to have some degree of error. The most important point, again, in meta-analysis is that it has to be reported on PRISMA guidelines. Prefer reporting system for systematic reviews and meta-analysis. And the highest level of evidence has been generated by meta-analysis. Whenever we are making guidelines, for example, in COVID-19, I am very lucky, Professor Mulazim Hussain Bukhari knows it, that we were making guidelines at the level of national level as well as at the provincial level. We, being the member of Corona Expert Advisory Group, we have to develop the guidelines and we have to look into meta-analysis, data and systematic reviews to give the guidelines. And these guidelines, they can only possible because of the highest level of evidence is coming out of meta-analysis. Next, a researcher wants to know about the typhoid vaccination drive in children of Lahore. Data is collected through in-depth interviewers, group discussions, media and newspaper from January to June 2019. In-depth report is written. This is an example of
क्वालिटेटिव रिसर्च डिजाइन है ये सब टाइप में दे दें मैंने कहा
Very good. This is a qualitative case study. Vaccination drive of typhoid in children, place Lahore, time from January to June 2019, and multiple data sources were used like interviews, focal group discussions, FDGs, observing vaccination drive, review documents, and multimedia. So the case study, event, problem, process, activity, program, a single person or several persons may be involved. It has multiple sources of data and boundaries are regardless of the time and place. If it is mentioned, it is good, but usually it is not possible to get the exact sample size, and in-depth understanding of the case is the basic aim. It is not the number that counts. It is the understanding that counts. So very well done that it is a type of a qualitative study where numbers are less important, sample sizes are less important, and we want to understand. Sometimes we have to go up to the level of saturation in order to understand and in order to explore, in order to know what actually is being there, to know especially the perspectives, the feelings, emotions, and understanding the things in detail. Number 16, a researcher wants to find out factors responsible for early marriages in rural areas of Lahore. Data collected through in-depth interviews and group discussions with rural communities, as a result of which factors are generated, which are responsible for early marriages in rural areas. Again, this is an example of
क्वालिटेटिव रिसर्च है मैम ये एथनोग्राफी है
very good, Muhammad Wasim. Grounded theory is there, qualitative research. You are good in qualitative research. In grounded theory, we usually have a few questions in our mind. We have the guiding questions, but we don't know exactly what is there. So we know that there is some factor that is responsible, or there are certain factors. It may be one factor, it may be multiple factors. So we have the theory. We know that there is some problem or there is some process. Like here, we have identified the problem of early marriages. And we have to do in-depth study. As we go in depth, then we generate more questions. When we are having this process with multiple data sources, and as we go along this process, we are going to generate more and more questions, more and more data sources, more and more methods of data collection, and this is called grounded theory. In grounded theory, usually very little is known while this process starts, and we have lots and lots of data in the end of this process. So it studies people's experiences with the process and creates theory how the process works. Focuses on creating theory from data collected in research. And we want to know what this data is being dealt with and how these coding and reverse coding is helping us in generating themes, sub-themes, and meaning out of this data. Next, a study was done by a researcher to know about culture and traditions of females living in a rural community which has infant mortality higher than its country's average. The researcher went to the community and observed the practices of the females. The best study design will be
Ethnographic.
very good, Dr. Rehana. As Dr. Wasim has already pointed out about ethnography, here is the ethnography. here we have the topic that the cultural traditions of females living in rural community, which has very high infant mortality. And there is a natural setting where the researcher goes in that society, lives in that society, identifies themselves in that context. And they are not behaving like an observer, but they are like the part of that community in order to observe them. And then the outcome is observes the values, traditions, beliefs, culture, and who is responsible for that problem. One of a very beautiful example of ethnography is kangaroo mother care. The researcher from New York, they live in Africa. They saw that there is a very good neonatal care that has been given by tying or by binding those small low weight babies with the mother or the father, and they come up with the concept of kangaroo mother care that has increased the survival of the babies, increased the chances of breastfeeding, and leading to the healthier babies in future. Right, the next scenario. In an air crash accident which occurred in Karachi, Pakistan in 2018, there were 2 survivors from the air crash. A researcher wants to know about the experience of survivors during the air crash. The appropriate study design will be?
Phenomenology.
Very nice. Yes, it depends upon the human experiences. The phenomenon here is the survivor from the air crash and the participants who have experienced that event. This is a scenario that I have taken from a published research, but I have seen such a scenario during COVID-19, where near the E-days, one of the aircraft that there were only few survivors from that aircraft because it was crashed just near the airport, not near, but almost in the airport, and there were only few survivors. And again, those survivors, they were involved in getting the exact accident details as well as how that all happened and what were the experiences. So this is phenomenology. Here are the references. There is a book called Leon Goddess, a beautiful book on epidemiology where all the designs have been given in much detail. And there is also a research book that has been written by myself. And these are the references, and thank you. Now